Welcome to Pet Patrol, Protector of the Pack. I'm Alan Braslow, your host, and today I have the privilege of having with me Dr. John Lewis from NorthStar and Phil Barnes, Director of Marketing from NorthStar. It's actually Phil's second trip back, so he did really good last time. We let him back in the door. This is going to be interesting because I think the topic that we're going to be discussing with Dr. Lewis is something that most of us know very little about, make very bad assumptions, and then question every time our veterinarian tells us something because it's in the area of dentistry. I guess the first question, and I always ask this, is what made you decide after becoming a veterinarian to go into the dentistry area?
Good question. I did not have a thought that I would become a specialist in dentistry when I graduated from veterinary school. In fact, I went out into general practice because when I was in veterinary school, every rotation I went through, I could see myself doing that specific specialty for the rest of my life. So I decided to just go out into general practice, kind of see what interested me the most after I had some more time out in general practice. And I found that because I hired on with a 5-doctor practice down outside of Raleigh, North Carolina, I found that I was one of the newer graduates there, and I had a little bit more dental training during my schooling than some of the doctors that had been out for a while. So I was getting a lot of internal referrals from those other doctors in the practice, so I kind of learned about dentistry out of necessity because I was getting a lot of internal referrals. And then at the same time, I was undergoing some dental work myself because when I was younger, I was a baseball player, and I happened to have a grounder that popped up and hit me in the teeth.
Ouch.
At that point, I had some root canals that lasted until probably I was about 26, 27 years old. Right after I graduated from veterinary school, they started to get infected, and I had to get some extractions and some implants placed. So I was spending many days off at the human dentist and got interested in it that way.
That's amazing. You think about what drives us to where we're at. So you actually, having gone through a lot of what the animals go through, you have a passion or compassion for them and an understanding of what, and I can see where I feel your pain sort of thing.
Absolutely, yeah. I can remember, sitting in the dental chair myself for an hour and a half, sometimes 2 hours with some of this work that had to be done, and that makes me think twice about how I position my patients, how I do my procedures, and so a lot of personal experience I think goes a long way.
Now, what I find interesting about what you do, and for those of you who are not familiar with NorthStar, NorthStar is in my mind, in the Delaware Valley, the premier emergency veterinarian practice and specialty. When my family vet, which is now Lisa Allmiller at House Paws, Lisa many times will send us to you folks when she said, I want a better opinion, because each individual there has their specialty. As to dentistry, my dogs have gone for cleanings. I don't say I go for cleanings, but probably it would be just as easy. My dogs go for cleanings there. What do you do that's different from what they would do? They usually don't take it past the cleaning or maybe an extraction or two.
Right, yeah. So I envision the general practitioner, when I was in general practice, and the general practitioners that refer to me, I envision those as sort of the conductor of an orchestra, and so they're kind of the first line of kind of taking a look in the mouth, determining when a cleaning needs to be done, determining when there's something more than a cleaning needs to be done. So my caseload is very different from a general practitioner's in that I don't typically do routine cleanings, if there's really anything such as a routine cleaning, but I think that a lot of anesthetic risk patients that primary care vets see the patient, they know that there's some pain in the mouth that's affecting that animal's quality of life. They know that that patient needs to be put under anesthesia, but they know that there's an increased risk associated with that. So we see a lot of high-risk anesthetic patients that need a lot of extractions and oral surgery. We see a lot of patients that have oral tumors, and we see patients that have jaw fractures. So not just dentistry, but oral and maxillofacial surgery is what we do as veterinary dentists.
Now, you go through education-wise. Give the folks an idea. This is not quick, of what you have to go through and the years that it takes to get to where you are today.
Yeah, very similar to a human oral maxillofacial surgeon, but its first step is undergrad and then veterinary school, and then either an internship or an equivalent out in private practice before going back to do a residency. And virtually all the residencies in dentistry and oral surgery these days are a 3-year residency that requires going back to academia to not only be able to learn how to do these procedures, but also learn how to interpret studies and do studies and be able to submit publications and that type of stuff. So a lot of additional training beyond the veterinary school. And that's one thing. When I was a professor in veterinary school, I realized that we don't give our veterinary students nearly as much training in dentistry as we would like to, and I understand why, just because there's so many different things that they need to learn about in those 4 years. But dentistry being a relatively new specialty, something that we really didn't pay much attention to 30 years ago, it's still trying to get its foot in the door in the veterinary educational process. And so, so when I graduated from veterinary school, I did not feel that comfortable with doing a lot of these dental procedures, so I had to seek out more and more continuing education opportunities, as well as eventually going back to do the residency to be able to feel comfortable doing some of this stuff.
I find that, and again, I've had pets, cats, dogs, we've had snakes, we've had alligators, we've had the whole gamut over the years. People don't seem to understand why dental work on, starting with a cleaning, why it's important. Can you give the folks an idea of, okay, you see a little tartar on your dog's teeth, your cat's teeth, here's why, this is where we go from here, and here are the things that can happen if you don't take care of it.
Yeah, just like the myriad of studies that are available on the human side that are suggesting maintenance of a healthy mouth helps to maintain a healthy body, there's more and more studies coming out on the veterinary side that suggest that as well. One of the most impressive studies that I've seen was one that was done by my resident mate when I was at Penn, Dr. Jennifer Rawlinson. She did a study where she looked at an inflammatory mediator in the bloodstream called C-reactive protein. And she looked at C-reactive protein prior to dental treatment and 28 days after dental treatment in the same set of patients, so they kind of acted as their own control. And she found that there was the degree of reduction in C-reactive protein was related to the degree of periodontal disease in their mouth. So after appropriate dental treatment, the measures of systemic inflammation actually went down in the body, and that's something that you can imagine how chronic inflammation can play a role in a lot of these other diseases that occur in our veterinary patients, such as perhaps chronic valvular disease of the heart, issues with liver and kidney disease, and so it's something that we're always looking for more and more cause and effect relationships between dental disease and other diseases in the body, but there is a good body of information out there right now that suggests that there is a link there between maintaining a healthy mouth and maintaining a healthy body.
So actually no different than for you and I.
Yeah.
If we don't take care of our mouths, the diseases can flow. We're going to take a quick break, quick commercial break, and then we will come back with Dr. Lewis and with Phil. And again, this is Pet Patrol, Protector of the Pack. Alan Braslow, your host. See you in a couple.
Today's show is sponsored by Hargrove Demolition, your demolition experts. Hargrove is a family-owned and operated business right here in the southern New Jersey area, bringing you 45 years of demolition expertise. Hargrove has all your demolition needs, from emergency demolition service to demolition equipment rental. Hargrove is one of the state-approved recycling facilities right here in the southern New Jersey area. No job is too big or too small for Hargrove Demolition. Contact them today at one of their 3 locations.
When it's time for Jersey Mike's to give a sub some sizzle, this is the way. The way it's always been. The way it always should be. The way it always will be. Because that's just the way it's supposed to be. Jersey Mike's. Be a sub above.
If you haven't been to Speed Raceway, what are you waiting for? You want to live fast? You want to make every second count? Then grab Grab the family. Round up the guys. Speed Raceway is 100,000 square feet of excitement, whether you're a kid or a kid at heart. Speed Raceway is the place for endless fun all summer long. Log on to speedraceway.com or just get here now.
When we make Beyond Natural dry dog and cat foods, we start with real meat as the first ingredient. We leave out corn, wheat, and soy. And we own where our dry food is made. 100%. Can other brands say all that? For nutrition you can trust and your pet will enjoy. Does your food go beyond? Learn more at purinabeyond.com.
Extra Innings is the nation's premier indoor baseball and softball training center, featuring indoor batting cages, 7 multi-use tunnels, and training rooms. Extra Innings can provide professional instruction, private and group lessons, and the best year-round clinics. Along with a nationally recognized pro shop that features the latest and widest selection of equipment and apparel, our experienced staff can provide you with the right instruction and help you find the best equipment for your ability and budget. Extra Innings, where the game never ends.
Today's show has been sponsored by More Than Gifts. Come see our new location in Marlton, New Jersey. Not just gifts, but more.
Welcome back to Pet Patrol, Protector of the Pack. This is Alan Braslow, your host, and again, today I have with me Dr. John Lewis from NorthStar Vets and Phil Barnes, NorthStar Vets, Director of Marketing. We were talking a little bit during the break about patients you remember. I know my own dentist will tell me he's got a few he remembers.
Yes.
I'm not so sure whether Fred had what some of Fred's reasons are at times, good and bad. But some of the patients that you remember.
Yeah, I mean, this could take hours to talk about, but I think that there's a lot of memorable patients for a variety of reasons. I'm coming up on 20 years out of veterinary school now, so I've got a lot of good stories, but I guess I'd start with probably one of my most famous patients. When I was at the University of Pennsylvania, a French Bulldog came to see me named Lentil. Lentil had a bilateral cleft lip and a cleft palate. And so he came to us at a time when, about 4 months prior, I had done a lecture at the medical school to some of the plastic surgeons and oral and maxillofacial surgeons who do some of the cleft palate repairs in the Children's Hospital of Philadelphia. And when I gave this lecture to this group, I talked about how neat it would be to get some of our veterinary patients and some of the children who have had similar surgeries together in one room to support each other and see that they undergo the same types of things. And so shortly after that, Lentil came in through our door, and he seemed to be the perfect ambassador dog for this program. And so ever since then, shortly after Lentil came to see us and we repaired his cleft palate, Dr. Alex Ryder and I were the surgeons on the case at Penn, and when we repaired his soft palate and hard palate, we didn't repair his lip because that was more of a cosmetic issue, and he looked pretty darn cute even with the bilateral cleft lips. So he still has a craniofacial difference when you look at him from outside, but he has been a great ambassador for this program that we do every year called the Best Friends Bash, which we get children and patients from the Children's Hospital and some of our veterinary patients who have had similar craniofacial surgeries in the same room, and it's just magical to see how getting them together and spending some time together, and us being able to spend time together as clinicians of dogs and cats and clinicians who work on people and trading ideas and the exchange of different techniques and discussions of patient care is just a really magical thing that I look forward to every year.
That has to be a great experience for the kids, because we know how good dogs are. One of my dogs is a therapy dog, and how they work with people and how they bring their blood pressure down and they make them feel better. But for a child to see a puppy or an adult dog, whatever, that had the same thing as them and how they're relating to it.
Yep.
So I guess some of them see it before the surgery, some after the surgery, and
Yep. And some of these kids that are at the Children's Hospital have to have 30 or more surgeries throughout their life to repair some of these craniofacial defects that they have. So it's nice for them to be able to take a break, and wherever they are in their level of treatment, they get to see that some dogs go through the same thing. And I thought when I first started to put this program together, I thought that it was going to be that the children were going to be so impressed and kind of enamored by the fact that dogs just don't have a lot of that, those problems with dealing with all the things that they have to deal with their disease and their post-operative period. But kids are the same way. They're just so resilient. It's just so inspiring to see them interact together.
that is amazing. Now I know you mentioned, we were laughing about another one of your patients, Jaws, not Jaworski, different Jaws. What can you tell us about Jaws? Because this was fascinating.
Yeah, Jaws was a relatively recent patient that we saw. He was unique in the fact that he was a case that was a cat that had sustained some type of trauma, probably got hit by a car, but we will never know what type of trauma he really had sustained. But a good Samaritan found him under their car and heard him meowing, and it took them a while to actually get him to come out from underneath the car, but they took him to their primary care vet, who stabilized him, got him ready to be sent to NorthStar, and then they sent him to NorthStar for us to assess his jaw fractures, and that's where he got his name, because of all his jaw fractures. And he had upper jaw fractures, lower jaw fractures, split of the two lower jaws down the middle, and he just looked very different than how he should have looked, and wasn't able to function because of all these jaw fractures. So a couple of surgeries, and he's gotten back to his normal self, and it was just inspiring to see how these owners who didn't even know this cat, these new owners who didn't even know this cat, took him under their wing, and just without hesitation, once they heard from me that it wouldn't be inhumane to consider treatment, they were all in. And so it was really, really neat in that regard.
Now, you had one other we talked about, which fascinated me. I thought it was a James Bond movie, Nero.
Yes, Nero has since passed away recently, but he was a police dog for Mercer County Police Department, and Pat Papero was the officer who worked with Nero, and Pat brought Nero to see me because of the fact that Nero had a fractured tooth, and this fractured tooth had gone underneath the gum line quite a bit. And police dogs use their fangs like policemen use their guns, and so it's something that they really have to have available to them. So a loss of a fang means stress put on the other three fangs in different ways, and so it can be kind of a vicious cycle. So we wanted to try and save this right upper canine tooth if possible. So we had to do some periodontal surgery where we lifted up the gums, removed some bone around the root to allow the root to act as a crown, and then we did a crown preparation and a root canal, and eventually got a metal crown placed on the crown so that he could go back to doing bite work. And he went on for many years after that to do good things for the department. And similarly, I had a recent patient that came in. His name was Legend, and he had a history of when he did bite work, they bite on a bite sleeve, and he was, instead of grabbing on and holding on like they're trained to do, he was grabbing and letting go, grabbing and letting go. And so, sure enough, he had a fractured canine tooth. And once we did a root canal on that tooth, removed the sensitivity from that tooth, and placed a crown on there, he's back to his normal workings. So that's been great.
That had to be a scary sight if that dog was coming at, Nero was coming at you with that metal canine.
Yes, yes. I would say the police officers don't seem to mind the extra bling that the crown provides, but that's not the main reason, of course, but it does provide some protection to a tooth that we put a lot of work into.
And I'm sure the dog appreciated it too, because while they don't complain, there's still the pain there.
Right, yeah.
We have some more questions for you. We're going to take another quick commercial break. Again, this is Pet Patrol Protector of the Pack. Alan Braslow, your host. Dr. Lewis, Phil. We'll be back in a few moments.
Sub some sizzle. This is the way. The way it's always been. The way it always should be. the way it always will be. Because that's just the way it's supposed to be. Jersey Mike's. Be a sub above.
Simply Gents, located in Marlton, New Jersey, takes care of all your grooming needs, including haircuts, straight razor shaves, massages, facials, manicures, pedicures, and waxing. To find more information or book an appointment, visit us online at www.simplygents.com. The secret weapon of a well-groomed man, Simply Gents.
If you haven't been to Speed Raceway, what are you waiting for? You want to live fast? You want to make every second count? Then grab the family. Round up the guys. Speed Raceway is 100,000 square feet of excitement, whether you're a kid or a kid at heart. Speed Raceway is the place for endless fun all summer long. Log on to speedraceway.com or just get here now.
When it's time for Jersey Mike's to make a really great sub, this is what we do. It's what we've been doing. It's what we've always done. It's what we'll always do. So what are you doing? Jersey Mike's. Be a sub above.
Today's show was brought to you by Alicia Kelly of White Horse RV Center in Williamstown, New Jersey. Alicia is your RV expert. Contact Alicia at whitehorserv.com or give her a call at 856-262-1717, extension 203. When you think of RV, think Alicia Kelly.
Today's show has been sponsored by Farmers Insurance in Voorhees, New Jersey. To protect your assets and the people you love, call Mike Skoranek, your local Farmers Insurance agent, at 856-336-2553.
We are farmers. Bum, ba-dum, bum, 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 bum.
Welcome back to Pet Patrol, Protector of the Pack. This is Alan Braslow, your host. And again, I'm here with Dr. John Lewis and Phil Barnes, Director of Marketing, both from NorthStar Vets. We've been ignoring Phil for this entire conversation. That is not Phil on the table. That's actually a real dog skull, and we have some interesting things to talk about and share with you in that area. But Phil, I haven't seen you folks in about 2 months. That was my last visit with one of my dogs.
Right.
What's new? How's the blood drive? How'd the blood drive go?
Yeah.
Do you still need blood donations, and how can people do that? What's new over at NorthStar as well?
Yeah, we had 2 very successful blood drives back in June, and one was in the Robbinsville location, one was in the Maple Shade location, and a lot of people came out, a lot of pets came out. I know the Red Cross blew through their goal for the day, so we had a lot of people come out. We got a lot of greyhounds that came out to donate blood, and we love the greyhounds because they're the universal blood donors for dogs.
I didn't know that.
Yeah, and so they were great days, so we were very happy. And since then we've had some other people sign on. The need for blood is constant, it's year-round, so we're always looking for donors. So anybody who has a pet at home that would like to consider being a part of the canine and feline blood bank at NorthStar Vets can go to northstarvets.com/bloodbank, and they can get all the information there. The requirements are there, and also there's an online survey they can take as a pre-screen to see if their dog or cat would be eligible. So we definitely would do that.
And it's certain sizes. They can't be under a certain weight, if I remember correctly.
That's right. Yeah, we're looking for cats over 10 pounds, I think, and dogs over 50 pounds. So they can get the amount of blood out of them, and it doesn't take too much blood out of the pet.
And I remember last time you folks were out that there's also a big advantage for the owner of the pet because of the blood work that you do.
Yeah. When the pets come in, we do an exam on the pet. We take a little bit of blood and we test the blood to make sure that the pet is fit for donating. And so a side benefit of that is that the pet gets a good exam by a veterinarian. They get the free blood panel, and then any blood that they donate, if that pet needs blood in the future, they can get that much blood back. So, so there are definitely some benefits to pet owners that they should consider, looking into. And all that information is there on the NorthStar Vets website.
Now, what is new that we don't know about that's
Yes.
happened?
So NorthStar Vets is, we're very happy. We were named a Level 1 Veterinary Trauma Center. And so this is a special recognition at the level of emergency care that we can offer to pets. And there are only a handful of facilities across the U.S. that have this designation. And we're the only one between New York and Delaware that is a Level 1 Veterinary Trauma Center. So we're very happy to have been accredited with that. And it's just one more thing that puts NorthStar Vets in a good position to treat dogs and cats and pets in emergencies.
That is right. That's good news. Dr. Lewis, tell us about the head. Actually, the jaw part especially.
All right, so I brought a little prop here. This is a dog skull, and this is about the size of a skull of a pit bull dog. And some of the things you'll notice is they have a lower jaw and an upper jaw, and this is the cheekbone of the dog. And the upper jaw and the lower jaw meet together back here in the back where they have a TMJ joint, just like people do, a temporomandibular joint. So we see animals with dental issues, but we see them present with uncomfortable chewing and pain associated with TMJ, just like people get. We can even see issues with certain breeds where they have, you've probably heard of hip dysplasia. They can get TMJ dysplasia as well, and that can cause some arthritis. It can cause some issues with the jaw locking in an abnormal way where the lower jaw gets caught on the upper jaw. So there's a lot of things that we get that our dogs and cats get as well. One of the things I brought the skull for today was to talk about brushing. Brushing is something that, if you ask me if I brush my own pet's teeth, I do not, but I would like to. I don't get around to it as often as I should, but that means that I'm going to need to have to do more frequent cleaning. So if you want to get as much mileage out of a cleaning as possible, daily brushing is by far the best option to do that. And some of the tips that we've learned through the years in terms of what allows for a good brushing experience is the thing that dogs and cats dislike the most is when you open their mouth. So if you can get to as many tooth surfaces without opening the mouth, then they will much better tolerate it. Okay. So I like to use something that has bristles, rather than something like a finger brush that has those little rubber knobs on it, because the bristles are going to act like a broom to just sweep underneath the gum line. And the gum line is the area that you really want to focus on because of the fact that that's where the communication between the mouth and the teeth and the rest of the body is occurring, and that's where the attachment structures of the teeth are. So back and forth motion or circular motion with the bristles pointed upwards on the upper jaw or downwards on the lower jaw to get into that what's called the gingival sulcus, or that little groove in between the gums and the tooth. And you can get to pretty much every surface on the outside of the teeth without opening the mouth. So save the opening of the mouth for last.
Now, I've never seen a toothbrush like that in any of the pet stores or whatever. Now, do you folks have those? Can people buy them from you?
Yeah.
Because that would make the length of it, especially, and the double brushes would make it a lot
This is
easier.
a veterinary type toothbrush that's made by one of the companies that has a lot of different veterinary dental products. And it's nice soft bristle. That's another important thing. If you want it to be well tolerated, it has to be soft bristle rather than a harder bristle. And I even soften a little bit more by running it under a little bit of warm water. And the other thing that I think is helpful to know is that sometimes they like the taste of the doggy toothpaste a little bit too much, and so they'll chew on the brush instead of letting you get the brush where you want it to be. So sometimes just a little bit of warm water will be a better option than actually putting paste on the brush, at least for starters.
I was just going to ask you that. It's just a matter of doing the brushing. You may not, you don't necessarily need to use.
Yeah, the mechanical effect
toothpaste.
of the bristles is going to be more important than anything you put on the brush. So, you can put just warm water on it. If we have a patient that has established periodontal disease, there might be some type of antibacterial solution we might have you put on the brush. But for the most part, it's the mechanical effect of the bristles. We want to get that plaque swept off the tooth before it mineralizes and turns into tartar, because once it's tartar, it's not going to brush off.
What about some of these sprays that get advertised? I mean, you know, the old adage, I saw it on the internet, it must be true. Not really.
Right?
Are there any out there that are actually of any value that help with the tartar?
Yeah, I think there are some, but you have to look at the ingredients that are in them. Like a lot of these products, they're upwards of 50 proof ethyl alcohol in them. So you don't realize until you look at the ingredients on the back, but that might have an effect on dissolving plaque, but it might be something that you don't necessarily want your dog to get hooked on. But I think that it's important to take a look at the ingredients, maybe run it by your primary care vet, or if you're having a relationship with a veterinary dentist, to have them take a look at the ingredients on any specific product that you decide to try.
What about brushing a dog's tongue? Because I know that my dentist says you brush your own tongue as well.
Right. Yeah, that will certainly help to decrease the doggy breath to some degree, because there's so many little nooks and crannies on the tongue that contributes to the halitosis that we sometimes, will smell. Even if the teeth look wonderful, the surface of the tongue can be a source for bacteria to hide in those nooks and crannies on the rough surface of the tongue. But that dog breath can also be due to pockets around the tooth. So sometimes, especially when you're doing a good job of cleaning the crowns but not really cleaning underneath the gum line, you can get some pockets that form underneath the gums. And there's normally a little bit of a normal pocket depth called the gingival sulcus, which is usually about 1 to 3 millimeters. But it's when we get those pockets that are 4, 5, 6, 10 millimeters deep that food and bacteria just get lodged up in there, and that's where you get that really bad dog breath.
The other question I had for you is in things that dogs chew. I mean, I was told by Ed Sleeper, our vet, many years,
yeah,
don't ever give your dog rawhide. He said, I do more. He said, unless you want to make me wealthy, I do more surgeries because of rawhide than anything else. And he got us into using bully sticks, and because he thought that they were digestible. Will they help with cleaning the dog's teeth, or are there other things? I mean, I've seen the greenies, and then the whole thing came out on greenies that you're going to kill your dog because when they digest them. What are good chews for a dog?
I'm glad you brought this up, because there's a certain number of items that I see causing the most tooth fractures in dogs, and dogs can generate a huge amount of force with their jaws when they close their jaws, so it's not hard for them to fracture a tooth, especially these back teeth where these upper, what are called carnassial teeth are. And carnassial is a term that interpreted literally means tearing of flesh. So when they were out hunting for themselves, that's what they used to tear the flesh off of the bone. But those carnassial teeth are at a risk of fracturing when they chew on things like real bones, nylon bones, cow hooves, deer antlers. I've seen a spike in tooth fractures with deer antlers.
Really?
So I would steer clear of all those things.
I'm guilty on deer antlers that are split. They love to chew out the marrow.
Yeah, they love them, but I've seen a lot of tooth fractures since they've become popular. So what can you let your pet chew on? Well, I think that supervised rawhide chewing is okay, but they get soft and they chew off a big chunk of it and then it just sits in the stomach, so you have to be careful with rawhides. I think that bully sticks generally have enough give that they're not going to cause a tooth fracture. I've seen maybe an exceptional case where the dog was only chewing on bully sticks and may have had a fracture here or there, but that's the exception rather than the rule. And I think that anything that has a little give to it, there's a veterinary dentist up in Canada, his name is Fraser Hale, and he says, if you wouldn't want to be hitting the knee with it, then it's probably too hard to give to your pet.
I love Canadians. It kind of brings it all home.
Yeah. I use that all the time.
That is interesting. Yeah. We have a couple minutes left, so we come back to Phil. We give Phil a chance.
Sure.
Phil, tell people how they can reach out. Tell them the specialties that you folks have. Reach out to we got you on one of the cameras, so we'll look directly at the camera. How they can contact you, what are the specialties that you folks do, because you do so many wonderful things. You know the routine. I want them to be able to come to you and not, like I say, the other guys who I don't really like to go to.
Sure. Well, NorthStar Vets has 2 locations now. Our main location is in Robbinsville, New Jersey, and we've just opened a satellite clinic in Maple Shade, New Jersey. You can get either location with the same phone number, so we're reachable at 609-259-8300, You can get all the information you need from us at northstarvets.com. And I definitely encourage people to check out our blog on the website and our newsroom and even our page on Facebook, because there's so many great stories, like some of the ones that you heard here today, that we share there. And you get to know our doctors a little bit better and the kinds of things that they do and are doing.
And when you say, by the way, satellite, I have been, fortunately or unfortunately, many times to the Maple Shade location. It's right by Lowe's off of 73 and 38.
Yep.
If that's a satellite, it's one of the nicest satellite locations I have seen in a long time. There isn't anything I think you can't do there.
Yeah, well, yeah.
Within reason. I mean, it is an amazing facility and an amazing group of people.
Yeah, it's a great location, and the same doctors that we have working in Robbinsville rotate through there. So if you do come to see one of our specialists in Robbinsville, but you live in South Jersey, you can, if you have follow-up appointments or recurring appointments with them, that's what that Maple Shade location is all about, because you can continue to see that same doctor, the same continuing of care, but at a more geographically convenient location.
And one simple phone number I found, which I really like. You got one number, you get through. The administrative part of a business can either make you or break you. And the people that you'll talk to on the phones at NorthStar they understand, they hear what you have to say, they take care of you where you need to be. It's a very easy process.
Yeah, it's a great group of people, and
no attitudes. I mean, it's just really a good group.
Yeah. And of course, it's open 24 hours a day, 7 days a week. So if you have a veterinary emergency, we're always there for you.
Phil, John, I really appreciate you coming in. I love running the NorthStar folks through here, because more people need to know about what you do and how you supplement what their family veterinarian might be able to do. As I've said, and I'll say it again and again, we have used NorthStar many, many times, and I have never been unhappy, never disappointed, and they have always done right by my animals. So thank you very much.
Nice to meet you.
This is Pet Patrol, Protector of the Pack. We will see you again real soon.